Hi, everybody. So today's yoga sequence is going to be all about how breathing, the essential act of breathing, that's something we never think about, but how that impacts all our systems, our endocrine system, to our neurological system, to our digestive system, and of course, our musculoskeletal system as well. So I want us to focus on the act of breathing because that's something we never think about, right? So, when we breathe in, we have to expand our rib cage all the way out because to get enough air into our lungs. And as we get fresh air into our lungs, it's able to circulate through our blood to get the oxygen to our brain. So those of you who complain to me a lot about having foggy brain and such, that's partly the reason why. Even the patients without any disease or illnesses, a lot of people just are stuck, structurally because we never expand and get motion in our muscles and joints in our skeletal system to kind of be able to have that kind of motion. So, sorry, I was just getting a call. So with that being said, I want you guys to sit nice and tall. If you're sitting on a chair, that's fine too. But I want you to have your hands with between your thumb and your index finger, just kind of wrapped around your rib cage out to the side. And I want you to sort of experience the breathing, right? See what happens to your rib cage. Oftentimes we live so much in this flexion because we're in pain. We're always like hunched over and everything happens in front of us. Life happens in flexion that we don't have this excursion, right? So I want you to have a feel for your rib cage. And I want you to take a deep breath in, nice and slow and steady. Take a deep breath in through your nose. And really breathe in the air to your lung capacity, meaning allow the expansion to occur. And then as you exhale, I want you to feel your rib cage sort of contracting and descending down, squeezing all the air out of your lungs, right? So I want you to just appreciate that motion. Inhale, the rib cage expands out. As you exhale, it contracts and brings it down. There's certain motion associated with that. So I want you to sit there. If you're sitting there hunched over, I want you to sit up nice and tall. Roll your shoulders back so that you're nice and open. Even have your hands behind you to support you and see if you can breathe a little bit better. Because your collarbones to your sternum and your ribs are attached right to your sternum and they wrap around all the way back to your spine. So that's what cages us in to protect all the organs in our visceral organs right in our digestive system, in our cavity right here, right? And so it's an important component, but oftentimes, if there's lack of motion and expansion and descension in that way, and if there is not that much mobility there, imagine what happens inside, right? So I want you to get an appreciation for that motion. We'll just take 5 deep breaths in. Place your hands behind you. Inhale through your nose. And just gaze up and allow that expansion to happen, and then exhale. Out through your mouth all the way down. Nice calm breath. And allow your spine to come forward as you do that. Inhale, open, and extend and expand your rib cage, allowing air into your lungs. And exhale. And again, 3 more. Inhale. And exhale. Take a deep breath in through your nose. Good job. So a lot of the times I find that with the patients that come in to see me for neck issues or shoulder issues or even their low back issues, it's often that some segment in their bones or skeleton are stuck. And when things get stuck, it's not a good feeling. And many of you guys who have your lungs affected or your heart affected by your lupus, there's going to be a little bit of a lack. Because of pain, you're not breathing as much. So that excursion is not there. And when there's no excursion, what happens is we get stagnated air. So the air becomes very stale. And so we sort of perpetuate that. And when the air becomes very stale, it's not very healthy environment inside, right? Sort of like our house. If the filters get really dirty and we're not able to have the full, air be recirculated every so often, it's just going to be bad toxic air that you're breathing in and out. And that's not so fun. That can't be healthy, right? So keep that in mind and really work to, take a deep breath in through your nose for 5 seconds and then exhale out for 10 seconds, nice and slow. A lot of patients want to kind of jerk their motion up, but that's not the way you should do it. You should have a very calming sensation. So work up to it, come back to this practice anytime you want to. Okay, so nice calm breath in, even and steady, and then exhaling out and just getting in tune with the mobility that you have in your rib cage as it relates to your lung capacity. With that in mind, whether you're sitting on a chair or sitting on your sit bones like I am, you're going to go ahead and inhale your right arm up and exhale, bend over to the left side, expanding the right side of the rib cage all the way up and back and left side. We're breathing into left and the right lungs separately, really expanding, just kind of facilitating that expansion by leaning to the side. Inhale up and exhale and back. This time, we're going to go ahead and inhale and exhale and inhale all the way back further into our left lung space and back. And you should feel this nice stretch, just warming up our spine. Inhale up and exhale and inhale again and get a little bit more air into that right lung space and back, right? One more time on each side. Left arm up, inhale and exhale, and inhale up and get a little bit more expansion into that left lung space and rib cage and back. Right side up, inhale and exhale, lean over to the left side, inhale and exhale. Just get a little bit more excursion and movement in that rib cage. Any type of movement is a good thing. So I want you to interlace your hands and pull it out palm side forward. And then I want you to go inhale up and really expand the rib cage and exhale down as you keep your arms up. Palm side up toward the ceiling. Inhale into the rib cage again. And exhale. And inhale. And exhale. And inhale and exhale. Bring your arms down by your side. Okay, good job. So now what I want you to do is I want you to interlace your hands like this. Or let's do one palm over the other. And then I want you to place it right under your belly button. And then on your right torso, we're going to take it up the right torso, the ascending colon, to the transverse and descending colon. So we're making a clockwise movement going up the right quadrant, across right below your rib cage, and down the left side, which is the descending colon. And that's how our food gets digested. So those of you who struggle with this kind of pain, you can kind of do this soothing massage. I remember I grew up in Korea, and in Korea, when you have digestive issues, they associate that with your chi or your energy source being blocked. So my mom would warm up her hands and do that soothing massage in my belly. And within minutes of her healing hands rubbing my belly like this, I would miraculously feel so much better. And that's, I think, the age-old wisdom of the Eastern medicine, which I love. So that's what I'm teaching you here, structurally, to promote the mechanical flow of energy in your own body so that you have the power to sort of heal your own body, right? Or if you have a spouse, or if you have a mom, or if you have a sister or a friend who can do this for you, another set of hands is not a bad thing, right? So let's just stop and take a break, and we're going to go ahead and come onto our backs. So gently, however way you want to get there, I want you to get there. I'm going to move my amplifier here out of the way. And then go ahead and lie on your back. And once you're back, on your back, what I want you to do is now I want you to go ahead and straighten both legs, right? And then I want you to bring your right knee up toward the right chest and pull that right knee up toward your chest, sort of squeezing that ascending colon on the right side. And hold, take a deep breath in and exhale. Take a deep breath in and exhale, and bring that right leg down and bring the left knee up, all the way up. And then squeeze it in. See if you can bring that knee toward the left armpit and really squeeze it. And then that sort of stimulates now the descending colon. Just any type of a movement is a good thing. So we're not used to moving. And lay it down. And then go ahead and bend both knees, feet flat. And then we're going to go ahead and gently brace yourselves, pull the full length of your arm down, lift your bottom up in the air, and go a little bit into an extension as you inhale into that lung space, stretching the front side of your body. And then let's exhale. We're going to do that 5 times. Inhale and lift your bottom up with control all the way up as high as you can, breathing into the lung space. And exhale, nice and slow down. 2. Inhale and exhale all the way up. And back down. Inhale and exhale. Raise it up. And down. Inhale and exhale all the way up. And down. Good job. This time, I want both knees up to your chest, right knee and left knee. And just squeeze both knees up to your chest and just stretching both sides, all the colons, right? Your stomach is scrunched and release. And I recommend that you just lay there for a bit and just sort of feel your gut. Right? And let's end with left palm or right palm, whichever hand you didn't use when we're sitting. I want you to lay palm flat right under your belly. And then I want you to massage your belly coming up the right side across the transverses, and then descending colon down the left side and coming up, coming across and up and across and down 2 and up the right side and left and up the right side, across and down left, up the right side, across and down left. And those of you who have sometimes a constipation issue, or you have a digestive discomfort of some sort, those of you who have GERD, things like this are simple things that you can do to help yourselves, to resolve the situation or the symptoms that you have without any medications. So I hope you enjoyed this. Leave me comments, questions you might have. Please subscribe to our channel. If you like this, please like our Facebook fan page and join our group as well. Until next time, see you then.